When Sarah and I first met in college, I was really excited to get to know her because I was into art girls. Sarah was the spunkiest person in the whole wide world. Sarah and I had only been married a few years when she had her first seizure. She started having multiple seizures a day. And then after, the first few months, it was a complete lifestyle change. I kept losing Sarah a little bit more every day. Before DBS, we had tried all kinds of medications, and VNS and other brain surgeries weren't really an option. And being afraid is a perfect human reaction. But when you have nothing to lose, all the fear in the world is not going to make any difference. She took it and she went forward with her surgery, and we are both better for it. The truth is, we saw an improvement almost right away. She was back to being observational like an artist really is. She started getting the paints out, and so I knew we had change. The number of seizures was drastically reduced, and the type and severity of the seizures were reduced. When Sarah was at her lowest point, Sarah was not Sarah, she was somebody else. She went away from us for a few years, and then she came roaring back. The darkest days were very, very challenging, but they're nothing compared to how rewarding the best days are.
Thank you everyone for joining us today to learn more about Medtronic deep brain stimulation therapy for the treatment of epilepsy. This is a picture of Sarah. She's been receiving Medtronic DBS therapy for epilepsy since 2005, and she will share her story a little later in this presentation. My name is Fiona Lynn, and I'm a nurse practitioner at Rush University Medical Center in Chicago. I specialize in epilepsy and neuromodulation. Joining me today is Erica, who has been receiving DBS since 2019. Here is our agenda. We will briefly go through drug-refractory epilepsy and what that means. I'll review different treatment options and then focus in on deep brain stimulation itself. And we will end with hearing from Erica, who will share her personal journey from diagnosis through DBS surgery and how she is doing today. So let's learn a little bit more about intractable epilepsy. Today, there are 3.4 million people in the United States with epilepsy, and there are 150,000 new cases of epilepsy each year. It is estimated that of those with epilepsy, 30%, or about a third, will have epilepsy that is drug resistant. Now, what does that mean? Drug resistant, uncontrolled, intractable, pharmacoresistant are all terms that are used interchangeably to describe a person that has failed to become and stay seizure-free after an adequate trial of 2 well-tolerated anti-epileptic drugs. Now, if we consider 100 epilepsy patients that all start their first anti-epileptic drug, 47 of them will achieve seizure freedom on that one medication alone. For those who continue to seize, if we add a second anti-epileptic drug, an additional 13 of them will then achieve seizure freedom on 2 medications. Then, after 2 medications, any additional medications or combination thereof will only help about 4 more people. So in essence, odds of becoming seizure-free on medication alone drop significantly after 2 medications. Something to keep in mind is that with polytherapy, or the use of more than 2 drugs, side effects and medication interactions become a challenge. Now we ask ourselves, what's next? What options do we have for those that continue to seize despite 2 or more medications? A surgical intervention is considered in those with a clearly identifiable seizure focus or lesion that is amenable to resection or removal. This is the best chance for seizure freedom. A neuromodulation intervention is an option for when seizure reduction is the primary goal, especially for those whose surgery is not an option, they've already had surgery and continue to have seizures, or simply who do not want a large cranial surgery. Let's talk a little bit more about this surgical piece. In many studies, surgery referrals are delayed for an average of 22 years after a patient has been diagnosed with epilepsy, and more than 10 years after being considering intractable or failure of 2 or more medications to stay seizure-free. However, studies show that the earlier the surgical intervention is performed, the better the outcome. We've just discussed this surgery piece. Let's turn our attention to why neuromodulation is a good option for many patients. Currently, only 10 to 20% of patients with refractory epilepsy are good candidates for a surgical resection. This is why it's imperative to discuss options as early as possible in a person's treatment. So let's take a deeper dive into the neuromodulation option, deep brain stimulation, or DBS. DBS is a small pacemaker-like device implanted under the skin of the chest or abdomen that sends electrical signals through the leads to an area in the brain. It is designed to change or modulate how brain cells work by giving electrical stimulation to brain areas involved in seizures. This stimulation can make it harder for a seizure to start. It can stop the spread of seizures into a larger brain area, thus causing more injury, or it can even stop the seizure altogether. This stimulation may also make the seizure circuit less prone to allow a seizure to even start. It's important to note that treatment with electrical stimulation of the brain tissue changes that tissue without permanently damaging it. Let's watch a quick animation on how this works.
Medtronic DBS therapy for epilepsy targets an area close to the center of the brain called the anterior nucleus of the thalamus, or ANT. This is part of a network in the brain that's involved in the generation of seizures. While under general anesthesia, very thin wires called leads are surgically placed in a specific area of the brain where seizures occur. The leads are connected to extensions, and the extensions are connected to a small neurostimulator that is placed under the skin in the chest or abdomen to deliver stimulation therapy to the brain. Once these are in place, a programmer can be used to adjust the level of stimulation to suit the patient's therapy needs. The neurostimulator sends electrical pulses through the extensions and leads to stimulate the ANT.
Medtronic is a well-established therapy. Starting in 1987, the first deep brain stimulation system was implanted through to 2018 with the FDA approval of the Medtronic DBS therapy in the United States for the treatment of refractory partial onset or focal seizures. With more than 25 years of DBS innovation and the recent FDA approval of DBS for epilepsy, you may be wondering, what were the outcomes of the study that led to its approval? Overall, clinically, DBS is showing seizure reduction, seizure freedom in some, fewer injuries, reduced seizure severity, and overall improved quality of life. Let's look at some specifics of the Sante trial that led to its approval. Here is a representation of total seizure frequency. After 1 year of DBS therapy, you can see there was about a 40% reduction in total seizure frequency, meaning a patient implanted with DBS therapy for 1 year saw their total seizures reduce by 40%. This 40% reduction then continued to improve over the years, and at year 7, we see an almost 75% reduction in seizures. There is a trend of continued improvement from year 1 to year 7. The takeaway is that the longer the device is implanted and stimulating, the better reduction in total seizures that a patient can experience. Next is a representation of the responder rate during the Santé trial. This is showing a percentage of patients with DBS who saw a 50% or more reduction in their seizures. What this means is, if you are having, let's say, 10 seizures a month, and with DBS therapy, your seizures are reduced to about 5 seizures per month, then you would see a 50% reduction from 10 to 5, and then you would be considered a responder. If you look at year 1, there is a 43% chance that a patient would be considered a responder or see a 50% reduction in their seizures. Then the chances continue to improve each year that the person will be in that responder group. So there's a trend for improvement. If you see year 7, then there's a 74% chance that a person will see a 50% reduction in their seizures. Again, the takeaway is that each year, your chances of seeing a 50% reduction in your seizures and being a responder improves. Now that we've seen the study results and heard about the benefits of DBS therapy on seizures, let's review some possible side effects or complications. In addition to the risks and side effects related to DBS therapy, the following side effects can occur with DBS therapy for epilepsy: status epilepticus, changes in seizures, such as a new seizure type or worsening seizures, including increased seizure frequency, duration, and/or severity. Medtronic DBS therapy includes risks from surgery and possible side effects after surgery, both of which may include device complications. Implanting the brain stimulation system carries risks similar to other brain surgeries and surgeries not involving the brain. Please see important safety info at the end of this video. So to review, with DBS therapy for the treatment of intractable epilepsy, there was a 75% median seizure reduction at 7 years, a 71% median reduction in the most severe seizures at 7 years, and an overall 84% patient satisfaction rate after 7 years. That means 84% of patients with DBS were satisfied with their seizure treatment. So let's hear Sarah's story from her and her clinical team's perspective.
My name is Sarah. I have epilepsy, but I do not let it define me.
When I initially met Sarah for the very first time, that was back in 2004, she was so sad and so depressed, and it just tugged at my heart.
It was so bad, I was having 300 tonic-clonic seizures a month. That would be 10 a day. That's called not living life.
There's another, that's a little epileptic activity.
It is very frustrating to get to the point when you're taking care of a person with epilepsy and you've tried literally everything that's out there. The DBS for epilepsy is an option which we're very excited about. What is groundbreaking about this is Medtronic has been able to take the technology that they use in other neurological diseases and apply it to patients with epilepsy. DBS for epilepsy delivers controlled electrical stimulation to a part of the brain that we believe is implicated in the network of seizures. So when somebody has epilepsy, there's a network in their brain that becomes activated, and DBS is thought to interrupt that network. Patients that I would consider for DBS for epilepsy are patients that are over the age of 18, patients who have tried 3 or more seizure medications and continue to have seizures, patients that have partial onset seizures, and then also patients that are having a lot of seizures per month. DBS for epilepsy is not a quick fix. We know that the longer that the patients have the DBS in, the better the response is. They can have fewer seizures, they can have less severe seizures, and their quality of life improves.
Sarah, how have you been?
Good, how are you?
When we do the programming of the stimulation, we usually have set parameters that we initially start with.
We can change the rate of stimulation, how strong the stimulation is, where the stimulation is occurring. So there's all different parameters that we can adjust to better tailor that to the patient's needs.
It's given me tons of independence, so I'm just really, really happy about that.
With Sarah, she was on 4 different anti-seizure medications, and over time we've been able to get her from 4 to just 1, and that's huge for her quality of life.
I've seen new treatments, I've seen new medications, and I think it's really great because our patients need this. They need the hope for tomorrow.
Having a treatment out for patients with epilepsy is really useful for me because now I can say, okay, well, I have this option now, and look, you fit all of the profile, and that gives me a lot of hope. It gives patients a lot of hope too.
So, at this point, you may be wondering, are you a DBS therapy candidate? Are you at least 18 years of age? Have you been diagnosed with epilepsy characterized by partial onset seizures with or without secondary generalization? Have you averaged over 6 seizures per month for the last 3 months with no more than 30 days between seizures? And have you tried 3 or more anti-epileptic medications? If you are not sure or have more questions, please talk to your provider. It's also very important that if you think you are a candidate, that you get in touch with a specialty team at a comprehensive epilepsy center. If you are a candidate, here are what the next steps could look like for you. There's a preoperative assessment, a clinical examination by both your epileptologist and neurosurgeon, a neuropsychological examination, MRI, EEG, and then discussions with both your epileptologist and neurosurgeon to address any questions that you may have. In terms of the surgical procedure itself, you will be admitted to the hospital for the procedure. The surgery is typically done under general anesthesia while you're fully asleep, and you can spend about 1 to 2 nights in the hospital for recovery. In general, healing time is approximately 1 to 2 weeks, although some symptoms of fatigue can last up to 4 weeks. Finally, follow-up care. In general, stimulation is initiated about 2 to 4 weeks after surgery to allow for full healing, and settings may be adjusted more frequently in the first few months after surgery, and then about once every 6 months to a year thereafter. Now that we've discussed the surgery, outcomes, and workup, let's take a look at the patient device itself. On the left, you will see the actual battery or generator itself. It has many names, but they all refer to this part of the DBS therapy. This one battery is able to stimulate both sides of the brain. Battery life is variable and depends on the settings programmed for your therapy. This will be regularly assessed by your clinician at programming visits. On the right is the Intercept Patient Programmer, which is a device given to each patient after the DBS therapy has been implanted. It provides the ability to interact and check your device on your own. It has many useful functions, including being able to check the battery life. For instance, an alert will show on the screen when the battery is getting low and requires a surgical exchange. It can turn the therapy on and off. And finally, it allows patients to click a button to log their seizures. An additional benefit of the deep brain stimulation therapy is the ability to have an MRI scan anywhere on the body under certain conditions. Please talk to your provider before having an MRI. A common question is whether Medtronic DBS for epilepsy is covered by insurance. Typically, the surgeon performing the procedure will work with your insurance company to obtain the prior approval before the procedure. Please discuss any questions or concerns with your treatment team. Finally, it's important to note that Medtronic DBS has an extensive worldwide network with national and international aftercare availability. Now we'll hear from Erica, who will give us a patient's perspective on DBS therapy and how it has changed her life.
Hi, my name is Erica, and this is my son, Brady. I've had epilepsy for over 15 years. I had my first seizure in the middle of a shopping mall. I had no idea what happened. I was later told I had a grand mal seizure. I went on to having over 18 seizures of all types throughout the day without any warning. I had been in college to study neonatology, but was forced to stop due to these seizures. I tried everything from multiple medications to diet, attempts at decreasing stress and improving sleep. Nothing seemed to help. I found a neurologist who felt I may be a surgical candidate. I underwent a right temporal lobe surgical resection in 2014, and it seemed to help for a little while. But after a few months, my seizures returned and were now very different. I would have frequent focal aware seizures where I could hear and talk, but was drooling and I didn't know what was happening, and my chest and left side of my face would tighten up. It hurt so bad. I then spoke with my neurosurgeon who recommended deep brain stimulation therapy. It was life-changing. I completely trust my neurosurgeon and my neurologist with my life. I am so appreciative for their help. I had the DBS implant in April of 2019. Because of DBS therapy, I remained seizure-free since November 2019. I have been able to return to work as a special education paraprofessional, and most importantly is to be there for my 7-year-old son. We now can do things we love to do and couldn't do before DBS. Before DBS, I had no control over my seizures. I lost my independence and had to rely on my friends and family. Now I'm back to working, living my life. That's my DBS story, and I'm sticking to it.
That concludes our presentation today. Thank you, Erica, for sharing your story, and thank you to everyone for joining us today to learn more about Medtronic DBS therapy for epilepsy.
It is entirely a new life. I started having seizures when I was 23 years old, and I don't have anything anymore. The DBS completely stopped what was happening. I've been seizure-free since November. To be 100% honest, I was surprised. I was so surprised that this actually worked. As many surgeries as I've gone through, and it was just another surgery. It was literally just another surgery. Let's do this. Get it done with. Let's see if it actually works. Of course, it's not going to work. Let's move on. But it did work. I'm now seizure-free. I can do everything I wanted to do. My life now is freedom. My life now is enjoying raising my son. We can go geocaching, we can go biking and hiking. There's no way on God's green earth that we could have done it before. It was too dangerous. It was just my son and I out in the middle of the woods. If anything happened, it would have been bad. I do have a whole new life, and I'm enjoying every second of it. If anyone is considering the DBS implant, talk to their doctors, talk to their neurologists. Don't just sit there and think that it can't get better. DBS could be a possibility and could change your life.